So I invite, first of all, colleagues who have been working last year in 2023 with training activities. And in particular, there should be Alexis with training activities implemented so far for the epidemiological and statistical part. Please, Alexis, if you can take the stage. I will move the slide, so please tell me when I have to skip to the next one.
Thank you, Isabella. Good morning, everybody. Yes, I'm Alexis de la Bouclise from CIRAD. So in one of the work package leaders for the training activities. So to summarize what has been done in 2023 in terms of trainings that targeted essentially researchers and students from NVRI, but also some agents of the Ministry of Agriculture and some researchers and students from NARS and Amadou Bello universities. So there was first one training in using QGIS, a software dedicated to mapping and representing spatial distributions. It was a one-week training. It was performed in VOM at NVRI during March, and it gathered 14 participants, essentially from NVRI. The second training was training in sampling design and data management. It was actually a webinar organized in December. It lasted 3 days and it covered 17 participants. The objective was to teach participants how to use the principles of biostatistics to design a sampling framework when they are when setting up a survey, and also to teach some tips, basically, also some nice ways of organizing data in order to perform analytical works. The third training was in January, so very recent training. It was also a webinar. It lasted 3 days, and it was about risk analysis using MCDA, which is a method of specializing risks. So producing, which is very handy to produce risk maps, such as the ones you can see on this slide. And it's a method which is implemented in R. So and it's gathered, this training gathered 15 participants, also essentially from NVRI. And the objective of this training was also to help in the progress of data analysis, because we use data generated by the LIDISKI project to produce those risk maps. Thank you. Next slide, please. I'm going to give you a small summary of the trainings that have been accomplished since the onset of the LIDISKI project in 2020. In total, 52 participants were trained. So they are essentially, as you can see, people from NVRI and also some research staff of NARS, and we also train 4 representatives of the Ministry of Agriculture. Most of the participants are male, but it probably kind of represents also the gender balance within each of the institutes. And the trainees gathered, mobilized, 9 experts, essentially from CIRAD, but also 2 experts from Nigerian institutions, including Amadou Bello University and Obafemi Awolowo University as well. The next slide, please. The trainings can be classified into 4 broad themes, which are biostatistics, risk mapping, participatory approaches in epidemiology and socioeconomics, and socioeconomics. Next slide, please. There are different training delivery formats used, which include on-site training with experts traveling to, in general, to VOM at NVRI to conduct the training, which is this format is best suited when a close interaction between the expert and the participants is needed, and when field visits are needed to practice the methods taught during the training. There were also webinars, particularly for trainings in biostatistics, and also some trainings were delivered through online courses, so without much interaction between participants and the experts, but with putting online video and teaching material online that participants could access through the PRISM platform, which is maintained by CIRAD. Next slide, please. So if we can summarize the degree of participation for each of the training delivery formats, we can see that actually there was quite a low attendance of online courses compared to the other types of deliveries, compared to on-site and on-site trainings and webinars. Next slide. And
thank you very much, Alexis, for the overview. We now move to ICOR. I don't know if Benga can describe what has been done in terms of field actors capacity building.
Yes, thank you, Isabella. So, majorly, I'll be talking about our activities around the implementation of the Community Animal Workers Program in Kano State, and some of our activities in terms of supporting the various states across our implementation states, and then some of the activities we did over last few months. Please, next slide. So majorly, we actually did some training of community animal health workers in Kano State, where we trained 68 community animal health workers. And majorly what we taught them was around disease surveillance, and especially around Newcastle disease and PPR disease. And then we also trained them on how to use technology in actually reporting diseases to the state. And then we also engage with the state institution to actually have a desk officer to actually manage the affairs of the community animal workers in the state. And then two state supervisors were also established for the state. Overall, 68 community animal workers were trained, and the platform, majorly for the disease reporting, they make use of Android phone. We also realized that about 8 of them were not having Android phone, and they were provided with this Android phone. And one of the things that we also did was to establish the distribution channel for them to actually access vaccines to protect against the Newcastle and the PPR disease. Please. Next slide. So again, we also went further to other implementation states, which is Bauchi and Plateau states, to actually look at the we looked at all the reports that have been generated in these states over some times, and also identified the major issues that they have been facing based on the report they've been generating. So we engaged with the supervisors in the state and brought this supervisor actually went ahead to actually facilitate put up some training in all these areas. And some of the focal area were actually around disease surveillance and reporting. And so these supervisors came in and then put more training regarding this for this community animal health worker who had been earlier trained since 2022. And then We also realize that some of the community animal workers also don't have some phone, because earlier on we are giving them over almost 50 phones earlier on, but then some others were not having their phone had already got missing or misplaced. So we gave them additional 5 Android phone for them to aid their reporting, because actually they've actually been using paper-based to actually report their their disease to report their disease to their supervisors. And overall, 49 community animal health workers among the initially 70 trained were present for that particular training, and then 4 managers were actually engaged to further provide support for the desk officer within the 3 states. Next slide. Thank you.
Thank you very much, Benga. Now we move to NVRI, and in particular on the important aspect related with the installation of solar panels. So I invite NVRI, Ismaila and Dr. Shock. I don't know who is going to present, so please. So I don't know if Ismaila or Dr. Shock are going to present their own data. In the other case, I can do it.
Okay. Can you hear me now?
Thank you so much. Sorry.
Okay, so thank you very much. We know that power supply has been a major challenge in Nigeria, and in order to provide a stopgap, through the project, solar panels were provided in order to save these resources as an alternative power supply. From the project inception, we're looking at introduction of climate smart solution in order to provide a viable alternative energy source. As we can see in most of our stations, we have generators that we use, and through the project, 5 NVRI laboratories were given solar panels. As we can see, this is for the HQ. We have solar panel installed in Kaduna outstation, Yola, Katsina, Kano, as well as Bauchi. Next. Next, Isabella.
Should be already the next one.
Okay, so yes, this is fine. Yeah, in order for us to be able to assess the cost benefits of the solar panel, we looked at the data that we've been gathered at the outstations vis-a-vis that was in 2020, because the solar panel were installed in 2021. And if you look at the data, you find out that over the time there's been, especially in terms of power supply, public power supply, we have metered and unmetered power supply in 3 of the outstations. And so far, so good. By the time the solar panels are being installed, we found out that there's a considerable decrease in the cost of energy in these outstations, except for this year, for Bauchi this year, there's a considerable drop in terms of price that is used for power supply, because now, initially they were on estimated billing, and now that they have a meter supply installed, the price has considerably dropped from 20,000 they were paying for metered power supply to 5,000, which is huge in terms of, especially when you look at the inflation in the country now. And for Kano, there was a bit of increase because the solar panel that was installed in Kano outstation was stolen from around September, and that has brought the outstation to go back to the fully to public power supply, which has considerably increased the price from 3,000 to 105,000. Then for Yola Lab, also, there was a bit of an increase in the cost because of inflation and high cost of energy supply. For generators, same, they'll be able to cut down expenses in terms of generator for them to power the generator. In short, in 3 of the outstations, or almost 4, they don't use the generator at all because of availability of solar panel. Next, Isabella. So in terms of vaccine sales, from 2019, we're able to gather the data in this outstation, and we found out that there's been tremendous increase. In short, in some area, we have like almost 10-fold increase, like Kano, where we had almost like 10-fold increase in terms of 5-fold increase in terms of sales of vaccine. And some of the vaccines are from neighboring states also being warehoused in some of these outstations because they know that there's a constant power supply to be able to keep those vaccines in good shape. Next. Isabella, next. So overall, to look at the impact of the solar panel, we'll be able to see that the solar panel has actually enhanced the quality and quantity of vaccines stored in these locations as a result of availability continuous cold chain. And then we found out that the diagnostic activities in some of these laboratories have considerably improved. And also, just like we showed, that the sales of vaccines have almost doubled and or tripled in some areas of the laboratory, except for energy power supply, where we have increase in as a result of inflation. And also, we believe that installation of solar panel in these outstations has made a positive impact in terms of use of climate smart technology. Next.
Thank you very much,
thank you very
Ismaila.
much.
Thank you very much, Ismaila, for the overview and the nice and positive inputs coming from the installation of the solar panel. We will now move to another, let's say, activity that has been maintaining the consortium very busy, which is related with capacity building to supply efficient Newcastle disease vaccine. In the previous, let's say, period, there have been an intensive surveillance, as we will understand also from the next presentations. And this surveillance has provided new viruses to be characterized, even in terms of virulent Newcastle disease viruses. They have been isolated and antigenically characterized. In particular, what we wanted to do together was to understand how these viruses, virulent viruses identified in the field, were matching the antibodies produced when the vaccine produced an NVRI were used. It was demonstrated that there was the circulation of a genotype called 14.2, which is a virulent one, able, let's say, to escape a bit the vaccine-induced immunity. So these viruses were being a bit far away than the antibodies produced using the vaccine-produced NVRI. So these escaping, let's say, mutants have been used both in order to produce a simple inactivated ND vaccine, and this was done together with NVRI, so preparing inactivated vaccine that can be easily produced there. And in addition, an experimental trial was implemented in order to evaluate how these new inactivated vaccines, but also the conventional vaccine available in Nigeria and NVRI, can be used in order to control the disease and the circulation of these challenging virulent strains. So last year we have been busy with a lot of experimental trials together with colleagues from NVRI in order to see how well matched could be let's say, the vaccine schemes available. So 67 groups have been organized in order to test the different combinations. Having live I2 vaccine, which is the thermostable, easily available in the field, even in village chicken, and try to use them as a priming, but then using booster to further, let's say, improve antibody response in different kind of combination, including the use of inactivated vaccine, which were prepared with the homologous to the vaccine challenge virus, which is the one I was referring to as an escaping mutants. They were then unvaccinated sentinels in contact, and we monitor how the situation was evolving in this experimental trial in order to identify, let's say, the recommendation for the use of the vaccine available at NVRI. So after an intense, let's say, analysis of results, what we demonstrated with this experimental trial was, first of all, that intervention and vaccine campaigns based on a single intervention will be not effective at all. So using I2 vaccine thermostable just one time will not help controlling the disease. It's important to have a booster, and it is, let's say, recommended to have a significant increase of antibodies to use a subsequent vaccine booster using an heterologous vaccine, so different than the one which has been used for the first inoculation, for the first vaccination, which was mainly the I2 vaccine. And in addition, the important to do and administer the vaccine in individuals as eye drops. The other important aspect was related with the possibility, in particular for long life animals, to use inactivated vaccine, and in particular the one homologous, which gave very good results in terms of antibody response. And it is extremely important to periodically reevaluate the vaccination strategies and know very well what is circulating in the field. So on this basis on this experimental trial, we have been trying to merge together some recommendation, and we are now working as a consortium in order to evaluate how to disseminate this guideline that has been produced based on the scientific evidences. So the other important action, let's say, that have been implemented in 2023 is related with the ability to identify Newcastle disease and characterize its virulence. In particular, what we have been trying to do was to develop a diagnostic test that can be, let's say, a bit easier than the ones now available in order to screen and monitor the virulence of Newcastle disease. Conventional, also from WOA chapter, what is recommended in order to identify the virulent Newcastle disease viruses is to do clearly an initial screening for the agent, which is the avian paramyxo-1 virus, and then when there's positive results, to identify the pathogenicity through an in vivo pathogenicity test, which means having animals to be infected intracerebral and demonstrate its pathogenicity. This is extremely time consuming and requires a dedicated facility, and even ethically to use food animals is not that best option possible. In the other perspective, there's also the possibility to do molecular pathotyping, which is still recommended and included by WOA chapter, but at the same case, when you do have to do sequencing and know which is the properties of the viruses at the cleavage site, you need to have sequencing facility. And this may be not possible in multiple scenarios. So what we have been doing, thanks to the project, was to test, let's say, a method able to diagnose the presence of virulent strains using probes. So a simple real-time PCR that can recognize, based on different primers and probes, if the viruses are the aggressive one or the lentogenic, not causing issue in the field. So it was validated according to the WAR recommendation and tested also clinically on samples collected in Nigeria, demonstrating the ability to identify the virulent strains that have been detected in Nigeria. And this tool is going to be helpful not just in the Nigerian context, but even beyond the border, because allow to define how to approach virulence characterization without the need to have a sequencing facility. So what's next then for the project? Next year, or better, this year, we will be busy still with trainings. They will cover multiple aspects from the biostatistics and economics training to monitoring of the co-activities and training across the states in order to use the disease reporting tool. There will be also a continuing evaluation of the impact of the source of electricity, as we have been doing last year and presented today. There will be also the need to further improve NVRI vaccine strategies. And in particular, the plan is to optimize the manufacturing process, and there will be, I bet, so a company visiting them in order to improve further the production. Which is important because, as you understood, there have been an improvement in the vaccine sales, and so production is strategic to be, let's say, maintained and improved. We will also work in order to disseminate the results of all these scientific activities, both for vaccine, but also in terms of diagnostic capacity. The new tool which has been developed is not that easy to be used, and there's the need to, let's say, implement dedicated webinar in order to demonstrate how to use these diagnostic techniques. So I thank you very much for listening, and I'm open for questions together with colleagues.
Thank you very much, Isabella. Is there any question in the audience? Right, so I mean, it's capacity building activities are really like at the start, at the front of all of activities, because thanks to this, we can better engage, better understand, and better develop tools for animal surveillance and control. So a lot of very important output from this project. I did see a hand here from Aruna Abarshi. Please take the floor. Unmute yourself. You have a question?
Voilà, je voudrais juste saluer cet événement que vous avez bien voulu organiser sur la santé animale. Et j'ai compris que, et ça parle beaucoup du Nigeria, ce qui est une bonne chose. Moi, je suis Haruna Abarchi, je suis pastoraliste du Niger. Donc nous sommes un pays, en tout cas, qui fait beaucoup de transhumance. Alors, qui dit transhumance parle véritablement de la santé animale qui est souvent difficile à maîtriser, parce que un des points négatifs vraiment pour la santé, pour la transhumance, c'est la maîtrise de la santé animale. Donc, je ne sais pas, puisque notre bétail va au Nigeria, continue au Cameroun, etc., etc., quel dispositif, qu'est-ce qu'on peut faire ensemble pour qu'ensemble nous puissions travailler ensemble pour faire un minimum, ou du moins pour avoir un minimum de maîtrise de certaines maladies animales pour pouvoir les contrôler, les gérer et même lutter véritablement contre elles. Voilà ce que je voudrais poser comme question. Merci beaucoup.
Merci. Je vais d'abord traduire votre commentaire en anglais. So here we have a comment from a pastoralist from Niger, so just a neighbor of Nigeria, really highlighting the fact that well, a lot of the diseases we are talking about are transboundary diseases, so they are crossing borders, and it's really something we have to take into account if we want to control those diseases. And indeed, it's very important. And think some of the tools here we develop will be helpful at transboundary level. So, c'est vrai qu'ici, on travaille sur des maladies qui sont transfrontalières, et donc ce qui impacte au Nigeria impacte aussi au Niger. Il est important d'avoir des stratégies qui sont transfrontalières, surtout ici dans le cas de la PPR. Alors, c'est sûr qu'ici, on développe des outils et on fait des recherches qui sont focalisées sur les Nigériens, mais les outils qui sont développés sont beaucoup peuvent être appliqués dans d'autres pays et dans des contextes transfrontaliers. Mais c'est vrai qu'il y aura d'autres, je pense qu'il y a d'autres actions qui sont vraiment focalisées sur la partie transfrontalière, et on vous tiendra au courant aussi de ces activités-là. Merci pour votre intervention. Is there any other comments on the capacity building? Maybe something I wanted to note about the solar panels is to highlight how impactful it has been for NVRI, but also for the communities around where solar panels have been installed. So it's really facilitating the access to vaccine, but also facilitating the role of NVRI as to do disease investigation where there are suspicion of diseases, because now they have storage facility that is more reliable to store vaccines and store samples, etc. And it's been so successful that they've managed to raise money to build new solar panels in other outstations across Nigeria. So it's starting to build up already and scale up on that side. So it's very good to see that even if the project is not yet finished, we start to have some scaling up because of the benefit of the project. I see there's another hand. Yes, from Dr. Zakaria.
Good morning, everyone.
Yes, good morning.
I am Dr. Pakachi Sam Zakaria, the Director of Veterinary Services, Kaduna State Ministry of Agriculture. First, I want to appreciate the project for the support to the NVRI outstation in Kaduna. For us as a state, we have actually benefited from this intervention because it has helped us in terms of storage of vaccines. Anytime the state purchases vaccines, that facility is actually where we stock these our vaccines. It has helped us in our cold chain delivery. My only concern and request is that for this project, you've not been involved in training community animal health workers in my state. However, we've had other projects that supported us, like Procom McCarthy supported us through the AmbuVet consult that we've trained over 69 community animal health workers, and they were supported in the field with solar-powered refrigerators. Now, one of the things that programs entails is that these community animal health workers will need to, once in a while, I mean, after every 2 years, go through a refresher training. And there's a cost element to it, which at the moment, the state is handicapped to do that. I don't know if this project, in terms of, would help us in training, in the retraining of these community animal health workers that have been trained in the state. Thank you very much.
Thank you very much, Doctor, for your inputs and comments. I will start answering, and then I can leave the floor to Ikore, who's been managing the work with community animal health worker. First thing is our work and activities with community animal health workers had to focus only in 3 states because of finance limitations. So we really worked in plateau poultry and Kano. And what we really hope is to be able to show to funders and governments how impactful training and having active community animal health worker can really help for animal disease surveillance and control. And hopefully it will bring more funds to activate or reactivate or refresh existing networks of community animal health workers in other states, or even improve this network where the network is too low for the moment. Basically, we had to limit ourselves because of the limits of funds, but clearly there's a need to see how activities and training and capacitating of community animal health worker can be a sustainable action that is really like a long-term benefit for Nigeria. And yeah, it will be good to have different views on how to make it sustainable. Manga or Ikore, I don't know if you wanted to add something here.
So Arnold, I think you've said it all. So because I think another thing that possibly, hopefully, if there's if the project if there's another project from CIRAD or EU, and possibly if Kaduna State is part of it, one thing definitely is it's not about training community animal worker again, it's about possibly building, still retraining them and building their capacity in certain areas that maybe they must have lacked or maybe needs to be improved. I think you've said it all. Thank you.
Thank you, Manga. There's another hand from Dr. Kobe. If you want to take the floor.
Yeah, hello, good morning all. And thank you for the good presentations, and I really enjoyed it. My name is Ashabi Ali Kobe. I'm calling from Bauchi, and I work with the Pastoral Reserve. And the Pastoral Reserve is one of the organizations that learned from LIDISKI project, where we train about 40 community animal health workers. And then in the process of doing that, one of the major challenges which we observe, that's a kind of a poor linkage between the LIDISKI community animal workers and the Pastoral Reserve, PARI community animal health workers. And then we feel like this gap really have been there because we are all working toward achieving some kind of a similar goal toward improving the livestock sector, development of livestock sector. And then another challenge we also observed is that a kind of sustainability of the project. We implement the project with the support of Canadian and Global Affairs Canada through Oxfam Novit, Nigeria. And then we're trying to look at how we are going to include entrepreneurship in the community animal health workers so that it can be sustainable. So I feel like the LIDISKI project can also, through the can also look at how to ensure that there is encompasses of the issue of entrepreneurship toward strengthening the community animal workers. Thank you very much. I really appreciate all the issue discussed here. Thank you.
Thank you very much for your comments. I think it will be important to collect all the feedback from the field actions, so that when we reach at the end of the project the stage where we discuss about recommendations, we can take into account the different challenges faced and issues, so that recommendations are also based on those feedback. Of course, we will hear more about community animal health workers and the work done in the next presentation. I'm very sorry, just to avoid losing too much time, I will stop here the questions. We will have time for questions at the end of the meeting, but I'd like now to move to the next session, if it's okay with everybody. You can always put your questions in the chat and we can see them afterwards, or raise your questions afterwards. Maybe they will be answered during the next session. Now, the next session is about engaging communities, and I will leave the floor to our colleagues at ICORE to take through this presentation. Please go ahead.
Can you hear me?
Good morning.
Can you hear me?
Yes, Marion, we can hear you.
Okay. So I will handle the slide, and we are going to present with Jesutomi. Can you see my screen?
But we don't see it in presentation mode.
Yeah, but you can see the screen.
Yes, we can see the screen.
Okay.
Yes.
Is it okay now?
Yes, all good.
Okay. So good morning, everyone. So it's my pleasure to present the second pillar of the project, which is engaging, and I will